Can hydroxyurea therapy help with HbSC disease management? Let's dive into an important question. Can hydroxyurea therapy help manage HbSC disease? Hydroxyurea, also known as hydroxycarbamide, is a medication often used for sickle cell disease, including its variant HbSC disease. Sickle cell disease is a genetic condition that affects how hemoglobin is produced. This can lead to abnormal red blood cells, causing pain crises, infections, and other serious complications. In HbSC disease, individuals inherit one sickle cell gene and one gene for another variant, hemoglobin C. So, how does hydroxyurea work? This medication increases the production of fetal hemoglobin, which is a type of hemoglobin found in fetuses and infants. Higher levels of fetal hemoglobin can help reduce the frequency and severity of sickle cell crises. This is because it inhibits the polymerization of sickle hemoglobin, which is a major problem in sickle cell disease. For many patients with sickle cell disease, hydroxyurea has shown benefits. It can reduce the frequency of painful crises, decrease hospital visits due to pain, and lower the need for blood transfusions. It may also help reduce the risk of complications like acute chest syndrome. Now, what about its application to HbSC disease? While hydroxyurea is well studied for sickle cell anemia, its use in HbSC disease is less common but still considered beneficial for some patients. The effectiveness can vary since individuals with HbSC often experience milder symptoms compared to those with sickle cell anemia. However, for those with more frequent or severe symptoms, hydroxyurea may be a good option to help manage their condition. When it comes to practical considerations, hydroxyurea is usually prescribed by a healthcare provider who will monitor the patient's response to the medication. Regular blood tests are necessary to check for side effects, like changes in blood cell counts. Common side effects can include nausea, vomiting, and changes in blood counts, while more serious side effects may involve bone marrow suppression, which requires careful monitoring. Ultimately, the decision to use hydroxyurea for HbSC disease should be made on an individual basis. This means considering the severity of symptoms and the overall health of the patient. In summary, hydroxyurea therapy can be helpful for managing symptoms in some patients with HbSC disease, especially those with more severe symptoms. However, it is essential to consult with a healthcare provider to determine if hydroxyurea is the right choice for each individual case.